Okay. Good morning, everyone. Bob Ravenscroft, Vice President for Advancement here at Bryan Health. It is, the 29th of December, here for our media briefing, last one of 2020. We will be taking Thursday. Well, we won't be taking Thursday off, but we'll be giving a break. We'll send out the statistics to the media, but no live media briefing on Thursday. Okay, so at midnight we had 491 patients here at Bryan Medical Center. 78 of those are COVID-19 patients. Of those 78, 18 are in the category of they're not cleared to go home yet, but they're no longer infectious, which leaves 413 non-COVID patients being treated here. If we go to the next slide, you'll see that we have 11 of our patients. Is that right? Yeah, no, 16 patients. I'm having trouble reading this, Brad. It's a little small here. 15 ICU patients, and then we have 11 COVID-19 patients that are on ventilators yet. Sorry, my eyesight is going in my old age here. If we go to the next slide, you'll see that 59% of our patients are now Lancaster County residents, and the remainder are out. Brad, if you could go back to the very first one, is that easy to do? What I just wanted to point out to folks, as we go into the New Year's, I know you're hearing it from others, but it's just really important to stay cautious and responsible with our New Year's Eve plans. Protect yourself and your family and your community. If you look back at this, this is a rolling 2-week average. After we hit our high of about when we were right at 150 patients or so for what seemed like forever, we had dropped down to 66 on what looks like the 16th there from the small print. And we've creeped back up to 78. So we're not out of the woods yet on this at all. And we just want everyone to be super responsible and careful and diligent. You know what to do with that. A little bit about vaccinations. We are currently in the process of what we are calling the Wave 3 of our vaccinations here. Again, healthcare workers were categorized as 1A or Wave 1 or Group 1A. And then within that, there were 3 different waves. We are in the last wave of that. And these employees are receiving the Moderna vaccination. We also are in partnership with St. E's, and the health department has distributed vaccine to Bryan and St. E's for community practices. That would be, physicians and their employees in private practice. That's a request from the health department that Bryan and St. E's are both working together and filling. It's going really well here at Bryan. I can't speak for others. I'm reading, some stuff about, confusion across the country, but we couldn't be more pleased with what our group put together, and they are being delivered efficiently and rapidly. Next week, we do anticipate receiving our second dose of Pfizer, and that's for those who received the Pfizer dose first week, so everything is on pace there. We have been getting a lot of questions about community distribution. I think it's important to say that we're following everything from the health department, and what we received are essentially the 1A distributions. We have pledged our support, and I know that they'll probably take us up on it in one way or another, but a lot of this is actually not in the health system's control. We're standing ready to assist and so forth, but what we got is what we got, and we're deploying it as instructed. Now, with that said, our team is putting together and will be armed to be a resource hub. There will be a lot of information coming out from the health department about where to go for community-based vaccinations when they become available, and we will make that. I know that a lot of people use our site as a source of information, so that will all be replicated there. We did have a couple of advanced questions. The first one was, what have we heard about those vaccinated still getting COVID-19, and what is the importance of the second dose? Well, first of all, let's talk about the doses. If you receive it, the Pfizer and the Moderna, which we have received, are 2-dose applications. When you receive the first dose, you have about 50% effectiveness from the vaccination, and then when you get the second dose, it goes up to 90 to 95%. So with that, the second dose is vitally important. As far as are we hearing about people still getting COVID after they've been vaccinated? I don't really have that information. What I do know is out of our 5,000 plus employees, right now we have 37 employees that are positive, and only 13 of them are RNs. I really don't know if they were employees that, received their first dose or not. It's just too difficult to get to that. But the percentages are very low, and that is not really a concern of ours, Andrew. So hopefully that's a little bit helpful. The other question is about the new strain and the impact on vaccination and testing. On our call yesterday with the entire team where we go over this, the infectious disease physicians and pathologists shared some information that, at least from the FDA said there is really no concern with the new vaccine not being effective with the new strain. And then as far as testing goes, the PCR test is absolutely not impacted. As far as the antigen test, I just got a message. I reached out to our lab in advance of this, and regarding the antigen test, what the lab said is all COVID antigen tests used at Bryan Health detect the nucleocapsid protein antigen. The mutation of the new SARS-CoV-2 strain is in the spike protein. At this time, there is no evidence to suggest that Bryan Health's antigen test would not detect the new virus strain. So I take that as really good news. What we will do, though, this is certainly getting into the weeds and out of the realm of my area of expertise. We'll bring some back, either a physician back or somebody from our lab to get into the nitty-gritty of this. But all early indications are, even with the mutated strains, we're in good shape with the antigen test, PCR test, and the vaccines being administered here at Bryan. Okay, so let's go to some other questions. How many staff have been vaccinated at this point? Do you have any idea what percentage of staff declined the vaccination? Do you have that readily available, Edgar, or should we just respond to them?
We'll respond later.
We'll get that information to you, Bailey. Have you heard of any serious side effects with your staff yet? I think it depends on what you consider serious. What I would consider serious, no. I do know that there have been a few situations where someone gets a fever and chill during the course of the night and a headache, but that's really, really, really infrequent. But it has happened where there's been what I guess I would consider some mild symptoms, and they are all in the emergency use authorization and the information given to employees before they take it. So pretty good luck there. When will the second doses start going out to those who got the vaccine in the first round? We are getting the employees and physicians who got the very first wave of distribution here were all the Pfizer vaccine. The Pfizer vaccine second dose shipment should be arriving either later this week or early next week. In the window of time, I think Pfizer 17 to 24 days, you got to take it in. Something like that. They will be hitting their window for their second dose as early as late next week, and the vaccine will be here for those employees to begin getting their second dose in the recommended window. So again, things are going really well here. I'm like you. I'm reading this stuff where there's issues in other parts of the country. We just really haven't received them yet. It's gone very quickly here. And we're just standing ready again to help in any way we can for broader distribution. And we're, like you, looking forward to news from the state on when and how that's going to all occur. Okay, it looks like we're winding down. As you noticed, we did not have the slide in there at the beginning representing the people who had, we did get one more question. How concerned should we be about the mutated strain of COVID? Oh, another question came in. That's going to be an individual decision, Bailey, on how concerned we should be. Based on what I just heard from the lab, thinking the antigen test and our PCR test detect it, and that the vaccine is effective with it, I'm not super concerned. What I think is maybe a little more concerning is, again, this is national information that I'm reading, that, it's very, very, very contagious, maybe more so than the first strains, and maybe impacting younger people a little bit. But until we learn more, I guess I'm not going to get too alarmed about that. I know you guys aren't necessarily involved in it, but have you heard anything about vaccinations at long-term care facilities? Not specifically, Matt, that I think would be helpful for responding. I know that is the second wave, and they're primarily running that through pharmacies, right, Edgar? So the state gets the vaccine, gets it to the pharmacies, and then there is a plan to do the long-term care facilities. Honestly, it's probably a better question for them today. Are we testing today in the snowstorm? Yep. The drive-through is still open despite the snow. We're very grateful and thankful they have the indoor drive-through facility for that right now. When could we see an impact of a spike after Christmas gatherings? Is that something the hospital is preparing for? Yeah, absolutely. Again, honestly, we expected that there would have been, and we're grateful it didn't occur, that there would have been a little bit of a rise after Thanksgiving. And I'd say there's been a slight rise, since, the first couple of weeks of December. But it's usually going to be 2 to 3 weeks after an event. So the Christmas gatherings being the event before we'll start seeing the impact. I think if there's anything that's really induces anxiety around here, it is the Christmas gatherings. And then 7 days later, New Year's Eve gatherings in environments where people definitely let their guard down a little bit more. That, it's concerning, and we are absolutely prepared for it. Again, it was just a few short weeks ago we had, right around 150 patients a day, it seemed like, and we're down to 78. We do not want to go back to that, but clearly we can do it if we have to. So I just want to reiterate, everyone, please be cautious and responsible and careful with your New Year's Eve gatherings and whatever lingering holiday gatherings you have. The positivity rate in our community is still, again, extraordinarily high. It's, 25% plus. Again, back in May, June of that, when we were, learning about, certain criteria for things, that was a outrageous positivity rate at that point to really modify our behavior and take it serious. So it is still a very high positivity rate ranking or percentage, and we also know that testing numbers were down over the holidays as people gathered too. So, okay, another question. The state is now blue as far as restrictions. That's the second lowest option as far as restrictions. Do you think that will have an impact on cases? I think we're going to find out if it does. Again, you backtrack to May, that if we were at a 25% positivity ranking, there, were pretty extreme recommendations. But I think, everyone's trying to manage this the best they can with all of the factors involved. But despite it being allowable to open up, everyone needs to use individual caution. I'll leave it at that. Okay, we did not show the slide at the beginning of our deceased patients as we send off, 2020 into the memory banks. This is, again, something we've been using internally, so we would just ask everyone to join us in remembering these families. Everyone have a great new year, and let's make 21 a lot better. Bye-bye.